So first off, when you start with a PE, you're going to want to check the respiratory system, the heart rate, and the temperature. You're going to check these three first because these are the three that can go up when an animal is stressed, and usually being handled for PEs stresses out an animal a little bit. First off, you're going to check the heart rate, and when you're looking for the heart rate, you're going to want to get 60 to 160 beats per minute for a dog, and 140 to 220 beats per minute for a cat. Then you're also going to listen to the respiratory system, and it's going to be 13 to 32 for the dog, and it's going to be 20 to 42 respirations per minute for the cat. And also when you're listening to the heart, you're going to listen for heart murmurs or an irregular heartbeat. Heart murmurs may not be very serious to begin with, but it could be signs of future problems. And when you're listening to the respiratory system, you want to listen for any gurgling. This could be signs of fluid in the lungs, and that could be a sign of pneumonia. And then you're going to want to check the temperature of the dog. You probably want to leave that for last because it's most uncomfortable for them. And the normal temperature is probably going to be between 100 and 102 degrees for the dog and the cat. And higher temperatures can be signs of infections, so those are very important to check.
You want to check the pulse while you're listening to the heart rate. The pulse and the heart rate should match, and if they don't, that could indicate a problem with the heart. Also, a pulse deficit. A weak pulse could indicate a decrease in heart output, so that could be another problem. Another thing that you will check when doing a PE is CRT, or capillary refill time. This is where you check the gums or mucous membranes in the dog's mouth, press on them, and see how quickly it takes the blood to go back in.
The animal you're going to check when you're doing a PE is you're going to check the eyes and ears for any problems that they might have. One of the things you want to check on the eyes is check their eyelids to see if they're curling in, which would be intropion, or see if the eyelids are curling out, which would be extropion. The biggest problem with the eyelids curling in is that the eyelashes could scratch the corneas, which isn't very comfortable for the dog. You also want to check for any kind of cloudiness that could be on the eyes when you're looking at them. This could be just a sign of old age, or it could be that they have cataracts. One of the things you want to check in the ears is you want to check and see if they have any sort of debris in there that could be ear mites. Ear mites are very uncomfortable, and you want to try and get those out of there if you can. Another thing we're going to check on our dog when we're doing our PE is you want to first watch their gait when they first come into the clinic. If the dog is walking funny, it could be a problem with the musculoskeletal system, or it could also be a problem with the nervous system. One of the main things that we're going to do to check the nervous system is we're going to flip over the paw, and the dog, if it has a normal nervous system, should flip its paw right back over. If it doesn't do that, it could mean that there's some sort of spinal injury, or there could be some nervous system problems going on. Another thing we're going to check when we're looking at the muscles and the skeleton is we're just going to feel the animal and feel to make sure everything's in place. And we also want to feel the hips and all the joints and see if they could have a luxated patella or if they could have some form of hip dysplasia.
take a look at the integumentary system. With that, you want to feel the dog to see if you find any lumps or bumps. That can be just a fatty tumor, which is usually benign, or it can be like an actual tumor, and that's not fun at all. Also, you want to look for any lesions or crusty, wet areas, because that can be a sign of a hot spot and that you want to have taken care of.
So when checking for problems with the urogenital or gastrointestinal system, it's important to get a good history to see what the dog has been vomiting or pooping, basically. Another thing you can do is listen to the abdominal area, palpate the abdominal area, check the vulva or prepuce for any signs of discharge.